Septal perforation happens when there's an abnormal communication between the two sides of the nose where the septum, the dividing wall, is broken down for some reason.
That can happen for a whole host of reasons. Most commonly it's from trauma, where you can get a septal hematoma inside the nose and that can cause breakdown of the lining as well as the cartilage in between. It can happen from previous surgery as well as previous drug use, and that can be illicit or over-the-counter medication.
And what happens when you get that communication, you have to understand you've lost lining and the cartilage that normally separates the septum. When you have this abnormal hole, the air flows through that, and so you get a lot of symptoms related to that. You can get crusting, you can get frequent and recurrent bleeding, and over time as that happens, you get little bacteria that are seeding that area. The perforation can often slowly enlarge, which can lead to problems with the nose structurally. The nose can start to lose support. You can start to see what's called a saddle nose, where the middle portion of the nose actually collapses, and that can become a real problem.
Yeah, it's important if you have a septal perforation, and a sign of that can just be crusting or bleeding or some infection. It can also just be whistling. Some patients actually just hear some whistling when they breathe. It's better to try to at least get it looked at right away, because oftentimes when the perforation is smaller, it can be closed much more readily than when the perforation is enlarged. And I think our practice is one of the few practices in the whole country, if not the world, that really specializes in septal perforation repair. I think there's other practices who will talk about it and they try to fix it using various techniques which may not be optimal, but I think we have really a wonderful answer for most patients.
The important thing really about a septal perforation is that you go to see experts who deal with this. It's not something that surgeons are doing frequently anywhere, but I think we probably have the busiest septal perforation practice probably on the West Coast. And that's a really critical portion of the approach to septal perforation, because your first chance at fixing it and closing the hole is really the best chance before the tissue's been injured, blood supply has become a problem, or there's enough scar tissue that it becomes more of a problem later on.
And that's really critical. What's important to understand is when you repair a septal perf, you have to really correct the lining on both the sides of the nose, as well as provide something in the middle that can support that structure while it's healing. There's a lot of practices that try to do things like moving mucosa from either the mouth or some fascia from inside the head, temple region, and just sort of create a flap on the inside of the nose, or maybe even put skin flaps in there. And those techniques are really suboptimal. They actually do more damage than good oftentimes, because once that breaks down, it can actually make the perforation that was there even bigger.
The reason that that's so important is the nasal lining is very specialized. And when it's broken down and you've lost nasal lining, you've lost the normal mucus and things that moisturize the nose and provide other anti-infection functions to the nose. And when you try to replace that lost lining with tissue from somewhere else, from skin, from other areas, it never assumes the normal function that a nose should have. And so the principal, really critical element of our approach to perforations is you have to close that hole with nasal tissue, with tissue that actually mimics what a normal nose should look like.
Absolutely, and I think, we've sort of posed the problem. The answer really is a technique that involves multiple advancement flaps, basically moving the septal mucosa that's still present in the nose from above the perforation and below the perforation, lifting all the tissue underneath as well as above, and bringing those two sides together and closing it on both sides of the nose, as well as providing some support on the inside so that that flap can survive while it's there.
And that's really important. There are quick fixes like putting a little plastic button in to close the perforation. These are Band-Aid solutions. They're temporary fixes that can actually sometimes lead to more irritation and more crusting over time. So we approach perforations the way we do our revision rhinoplasties and every other nasal surgery, which is we want to create a one-time, long-term, lasting solution for patients that is going to provide a really strong, well-supported nose that's going to last them the rest of their lives, and they can close the book on this problem and no longer have to worry about their nose.